So what are the principles of this Frenkels exercise? This before going to the patient, before starting the exercises, we have to give some principles, general instruction to the patients. So that should be the exercise can be performed with part supported or unsupported, unilaterally or bilaterally. Sometimes the patient unable to perform without support. So again, we have to give the therapist has to give the support to, and also part supported or also unsupported. And sometimes we have to give the unilaterally and also bilaterally. They should be practiced as smooth and also time movements and performed at slow, even tempo by counting out loud. So that means they have to count how much the count. Is he holding the 5 seconds or holding the 3 seconds? Okay, for example, task is the 5 seconds. So they have to count 1, 2, 3, 4, 5. So until 5, so they have to, if they're loud, so they are going to maintain the position in the until the 5 seconds. Consistency of the performance is stressed and specified target can be used to determine the range. So we have to train is like a task oriented training. So we have to be the task oriented. If we give any task, so should be, so if you want to do the movements, you have to finish in the within the 3 times. Like I mean, 3 repetitions have to practice. Or there should be task. Or otherwise, if we give the holding any object, so ask them to hold 5 seconds. Or maybe is the sitting from the standing. So from the sitting to the standing, have to do within the 2 seconds or 3 seconds or within the 5 seconds. So this should be task. So if they're not doing these things, so they have to practice until it is the task. So for these things, so we are going to do the positions are going to be the lying position, sitting position, standing positions, and also walking positions. So the exercise, the progress palms postures of the greatest stability. So lying and sitting. So initially we have to start in the lying positions and sitting positions. So and then we are going to do in the if they get progress. So we have to do in the standing and also walking activities. So in the standing and activities, so dynamic stability is going to be improved. And then as voluntary control improves, exercise progress to the stopping and also starting commands. So if they are getting improvements, so if the patient while doing activities, the therapist has to do stop the activities and also have to give the commands to start the other activities. So these are going to be, so while doing, so ask them to close the eyes and stop the activity and start the activities, turn right, turn left, and move forward, move backwards. So this type of commands are going to be, or we do the eyes closing, eyes opening. So this type of activities are going to be helpful to initiate or to improve the control of the movement in the who are having the coordination impairment. Concentration and repetitions are the key to the success. So this is the very, very important. The patient has to understand, the family members and caregivers have to understand these things. So concentration and also repetitions. If they concentrate, if the patient is concentrated, if the patient participate actively, if the person is participate actively, so they are going to get the more improvement. Sometimes, so during the practice, the training sessions, so we will fill a practical abnormal practical problems such as the patient is not cooperative while doing the exercise. Sometimes the patient is not interesting to do a repetition of the exercise. In those patients, the recovery will be delay and also recovery will be very slow. So that is the reasons we have to clearly explain. So what is the effect of the repetition and also concentration, how the improvement will be increased. So these type of things are going to be helpful to the patient to get the better results. So, and also we have to do the preparation for the patients. So the preparation should the patient is positions in the convenient postures. So which position is convenient? Either the supine lying positions or a half lying positions or crook lying positions. So whatever the patient is comfortable, so we have to give the patient positionings. And select the ranges, the decided, and also distance between the 2 points and the marked by the couch and also by the chalk according to the agreed count. So we have to draw a pictures on the couch. For example, if you draw a picture, so what is the distance? So we have to explain clearly to the patients. So this is going to be the numbers, the initial period to the next stage is first marking point is the 10 centimeters or 5 centimeters. So depends upon the patient's capacity and range. So we can draw the markings on the couch. So that is where is the starting point and also where is the ending point. So we have to explain. And also we have to give the 4 number counts. So here the start 1, 2, 3. Or otherwise you can give the 1, 2, 3, 4, or anything. Start or we can give the 1, or instead of start, we can give the 1 and 2 and 3 and 4 dots, 4 lines we can give. So ask them to progress from the starting to the until the 4. So if they do this type of activities, the patient can see the image and also can perform the activities. So untreated parts should be covered by the blankets to protect the privacy of the patients. For example, if you are giving the right limb, like a coordination exercise, so left limb should be covered with like a drape sheet, or we have to give the proper privacy to the patients. Then they are going to be the confident, they are going to be participate actively in the exercise regimes. Proper demonstrations of the about the exercise program of to the patients. So the patient must know the correct picture of about the exercise. So before giving the exercise, so we have to explain clearly. So what type of activity we are going to do. So how you have to perform it. So is it the lifting activity, is the dragging activity, or is the alternating or zigzag? So how we have to, they are going to do the movement, or so that those things, everything clearly explained with the image and also with the video demonstration or also live demonstrations. So if any patients get the improvements, so how the progression in the exercise program, how we can improve the progressions, how we are going to change the exercise program. So a polished re-education board or non-slippery surface is used for the exercise program. So for example, so it should be like a re-education board. So if you do the movements, for example, patient in supine lying positions. So if the supine lying positions, so if the couch, so if we use the any re-education board, so the board is going to be non-slippery and also is going to be polished. So they can, it won't get much slip, but it give the free and also smooth, accurate movements. So that's why we have to give on the like a re-education board. So dragging up the limb on the board and touching the marked spots with a voluntary halt. So here just now, so if for example, if the patient is supine lying positions, so if you want to do the hip abduction and adductions, so in the, this is under the limbs, so we have to give the re-education board. On the re-education board, we have to give the markings 1, 2, 3, 4. So we can give the command. So ask them to move the is a right lower limb, so right leg towards the 1. So then drag until to the 3 or 4. So that means they are going to move the leg from the 1, 2, 3, 4. So if they move from one place to another place, automatically the limb will get the abduction movement. So ask them from the until the 4. So ask them to bring it to the until 1. So it's going to get the abduction and adduction. So this means, so it looks like the simple movement, but who are having incoordinations, who are having the hypotonicity, it's a very difficult to do the movement. So it's they have to put more effort. So especially who are having the complete loss of muscle tone. So this simple exercise will improve the strength and also coordinations and also improve the accurate movements. So first one is the patient is unable to lift the, so that's the reasons we have to ask them to dragging. Just push the leg from the 1 until 2 and 3. If the progression occurs, so we have to ask them to do the lifting the limb. So from this, so that one is going to be from the 1, ask them to lift to the 2. From the 2, ask them to lift to the 3. So I have to lift the leg and keep it on the 3. And ask them to lift the leg and keep it on the 4. So this is the progressions. So dragging up the limbs on the board and touching the marked spots with the halt and the command. So ask them to do the halt and the commands. And it's limb unsupported movements. So we have to ask the unsupported movements means ask them to lift it up and I'll keep it on the markings. Unsupported movements touching the marked spots with the voluntary halts. So unsupported limits, we should not give any support. Ask them to lift the leg and keep it on the 3. From the 1 until the 3. From again 3 to 1. And 1 to 2, 2 to 3, 3 to 4. So all the marks, so if they reach to, first one is the dragging. So then is going to the halt, the lifting the limb and keep it on the 2. Lifting the limb, keep it on the 3. So this is going to be the progression. So because of if they reach to, if they get any progressions from the dragging, they can able to lift. So that means they're going to do the against gravity movement. So that is the reasons. So they're going to get the improvement. So next one is the limb unsupported touching the marked spot with a halt on the commands. So sometimes we have to in between the lifting. So ask them to hold at least 2 to 3 seconds until 5 seconds. The limb support touching the opposite side of the body, specific points with the heel or finger by the voluntary halts. So we can ask them to do the the shin heel. Yesterday, in the last class, we discussed about the shin heel test. So same thing, ask them to drag the heel on the opposite limb and the unsupported limb, or maybe with the fingers touching the opposite side of the fingers and the wrist and forearm and elbow on the shoulders. So with the legs, so we can, for example, if you ask them to touch the finger to finger or therapist finger in the supine lying positions, or change the directions. If the therapist put the hand in the air, so they try to ask the touch the hand in the therapist hand and change the direction toward right side and left side. So if we change these directions, so the patient is going to get the coordination, and also the purposeful movement is going to be improve the strength in the limbs. So limb unsupported touching the opposite side of the specific point with the heel or finger by a halting commands. So ask them to do the opposite side also. Bring this is the unsupported limb, bring towards the supported side. Or touch the hands, touch the heel, touch the shin. And also next one is the touching the fingers, which place the air by the therapist. So if the therapist hold the hand in the air, so ask them to touch raise the leg and ask them to put in the hand, or maybe touch the therapist hand with the fingers, or with maybe toes and also fingers with the lower limbs, with the upper limbs. So if the patient if therapist hold the hand, so ask them to put his leg on the hand. So ask them to touch the big toe with the little toe. So, or maybe the big toe with the middle finger. So if we give task, the patient is going to try to touch the hand, the foot, try to touch with the middle toe, or maybe a big hand, like a thumb and also middle finger, or maybe ring finger. So like that, we are going to increasing the progression. Therapist placing the fingers in the air and moving here and there, and patient reaches the point. So if you therapist put the fingers, so if you change direction here, the patient is going to try to reach the fingers. If therapist change, the patient is going to move towards the finger side. Or if you bring it forward, the patient comes here and change the directions. So he's going to do this thing. So it also going to give the control in the proximal shoulders. That means is going to increasing the stability, and also it increasing the strength in the proximal muscles. So according to grade of the disability, the exercise is started. So grades of the disability means, so we have to check how much of the weakness is it the grade 1 or grade 2, grade 3 or grade 4 or grade 5, the muscle power. So how much of the disability, so is it dependent or independent or semi-dependent? So how much percentage dependent? So according to the assessment, so we are going to give the exercise according to the patient degrees of the DIFA and also disabilities. So these are the examples in the supine lying positions. So, and also in the for the hip abduction and adductions, and also this one is going to be the hip flexion and knee flexions. So this is going to be the knee flexion and also along with the hip flexions. So we can ask them. So here just I want to explain about clearly. So first initial staging is we are going to do like a supine lying positions, and also are maybe in the comfortable positions in the half lying positions. If they get the progressions, so we can go to the sitting positions, standing positions, and also walking positions. So the exercise in the lying positions. So what exercise we are going to give in the lying positions? So these are going to be for the upper limb in the lying positions, the half lying positions, ask them to do the abduction and also adduction of the shoulders. So in the same positions, so we can draw one here, number 1, 2, 3, and 4 here. So if the patient is going to be move the hand towards the 1, 2, if you imagine this is the 1, if you draw a 2, if you 3 here, if you 4 here, so the patient is going to move the hand from here to 1 and 2 and 3 and 4. So that means he's going to drag the hand towards 1, then 2, then 3, and then 4. So this is going to be the shoulder abduction. So from this position, ask them to bring from the number 4 to number 3, number 2, number 1, and starting position. So this is going to be the adductions. So these activities are going to be improves the shoulder abduction and adduction activities. Half lying positions, wrist extension, wrist flexion and extension, ulnar deviation, radial deviation. The half lying position, if the patient is the lean against the bed, and also we can ask them to do the wrist flexion extensions. So we can ask them to do the flexion and extensions. So what extends? So maybe we can do the radial deviation and ulnar deviation. So same thing, we have to draw pictures and numberings in for example, if the patient is supine lying position here, so we can draw pictures here. So here we can put the 1, 2, and 3, and 4. So keep it here. So ask them to do like a ulnar deviation until 2, until 3, until 4. So while giving the flexion also, we have to place a one towel roll, or maybe we can give the like a any like a bed sheet roll under the wrist flexions. So ask them to do the until flex. So we can give it to the neutral, the pronation, supination positions. Try to bring them okay until here. So try to flex, 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 flex. So if it does extension, so same thing, pronations, ask them to lift 1, 2, 3, 4. So these are the tasks. So number 1 is neutral is here. So ask them to extend 1. So increase 2, increase 3, increase 4. So this is going to be like a progression. It's going to be extension of increasing the strength in the wrist extensors. So if you give the same, the radial deviations. So in the radial deviation, the first one is touch 1. So increase 2 and 3 and next 4. So this means if we change the data numberings as markings, so is going to, the patient is going to follow our commands. So the patient is going to get the improvements. So these are we are going to do in the lying position for the upper limbs. And also we have to give the sideline positions, flexion and also extension of the elbow. So we have to do the patient, ask them to sideline positions. So if the patient is here, so we have to mark it. The patient, the therapist has to put the hand or markings. So try to bend here, elbow flexion is the first 1, then 2, 3, 4. So that means a complete now elbow flexion. So it's going to be helpful to improve the elbow flexions. And also about the shoulder flexion. So with the extension of the elbow, so we can ask them, the patient is supine, the lean side. So ask them to do the same markings. So move forward 1, this is shoulder flexion, and some more, and it's going to be the flexion. So it's going to sideline positions, we are going to get the shoulder flexions. So who are having the muscle weakness, they are unable to perform the anti-gravity movements. So that's the reasons we have to do the first is the gravity eliminated activities. So which is also called as is the grade 2 movement. So if you know the Oxford grading of the muscle power, so we can understand what is the grade 1, grade 2, grade 3. So grade 1, if you understand the grade 1 and grade 2, so grade 2 is the gravity eliminated position of the full range of movement in the gravity eliminated. For example, we are having this one is the, for example, this is the biceps flexion. So that means a flexion of biceps activity. So this is the against gravity, opposite the gravity. So who are having the strength, so they're able to do. But in case of the weakness, they're unable to do the against gravities. So in those conditions, we should not ask them to practice in the against gravity. So ask them to do in the sideline positions. So they are going to do the elbow flexions. So this is going to be the, not the against gravity, this is going to be the parallel to the gravity. So that means the same directions to the ground. So they need the less amount of effort, so they can easily practice in the sideline positions. So that is the reasons. So we have to ask them to do practice in the sideline positions. So it depends upon the patient's strength. So we have to do in the sideline positions, supine half line positions, and also sideline positions for the upper limb. So coming to the lower limbs, so also same thing for the lower limbs, we have to in the lying positions, half lying positions, hip abduction adductions, how to do. So these things are the half lying positions, hip abduction and adductions. And also next one is the sideline positions, how to do the. So why this one is we are giving this the abduction adductions. So this abduction adduction also is not a anti-gravity movements. So this is the gravity eliminated positions. So parallel to the ground. So they are going to be able to do the drag the hip or do the movement, leg movements from the 1, 2, 3, 4. So that means they're going to move slowly. So who are having the less amount of like a power or less effort to the activities. So they're going to easily perform in the gravity eliminated positions. And also sideline positions, so flexion and extensions. So this also is a gravity eliminated positions. And also sideline positions have to do the flexion and extension of the knee joints. So this is the all are going to be performed in the initially we are going to do the gravity eliminated positions. So that means if they were having the grade 1 movements, like a flicker contraction in the muscles, so we can ask them to practice into the grade 2 positions, that is the gravity eliminated positions. And so is a half lying, so ask them to the flexion and extension of the hip joint. So this is the progression to the, after this is a flexion extensions. So this is going to be the slightly against gravity. If they are able to perform these activities, so next we are going to ask in the half lying positions in the flexion and also extension. So this is the flexion extension. Is slightly is against gravity. So it's a supported and also against gravity who can reach to the grade 3. So they're able to perform the grade 3 activities. So coming to the sitting, like in the sitting, so we have to give the lower limb exercise. So if the patient is sitting, okay, if you, for example, if the patient is sitting on the stool, so we have to draw a like in the numberings. So if, for example, the left leg and also right leg. So here we have to ask them to first, for if you have weakness in the right leg, so we can ask them to drag the right leg to the 1, some ask them to bring back. So from again, so from the 1 to the neutral. So again, from is ask them to do move to the 2 and bring back and move to the 3. So this is through the dragging. Ask them to drag the heel until the 1 and bring back to center and drag to 2 and bring back center, drag to 3 center. So this is the initial stage. So if they're able to do this one, so then again ask them to do towards the opposite side. Drag to 1. So this is the left side. So drag 2 and 3. So difficult. And also ask them to left leg towards the left side, 1, 2, and 3. If they're able to practice, if they are masters in the dragging movements, so ask them to slowly lift the right leg until the 1. Ask them to lift the leg and keep it on the 1. So ask them to bring it back. So then again ask them to bring it this right leg to until the 2 and bring back. And then ask them to do 3. The same thing we have to give for the right side as well as the left side. So this is the lifting. So after the progressions, again we ask you, the next progression is ask them to lift the right leg until the 1, and from the 1 ask them to lift until the 3. So alternate, we are increasing. If we are getting the progressions, so ask them to bring from the 1 to 3. Then 3 to 1. So he's going to be the lift and is bring it back here. Is going to the abduction and adduction. So if you move the leg from the foot over the 1, so if you ask them to move to the 3, so automatically he's going to get the abduction. So in the sitting positions, if he move, so he's going to get the abduction of the leg and also adduction of the leg. So this will help to improve the strength in the abductors as well as the and also adductors. So that is, we can draw a half circle or half moon circles. So draw in the numberings. So if you give the markings, so the patient is going to follow the markings. So always if you give the task oriented. So if you task, okay, if you, for example, if you are giving command to the Mr. X, okay, Mr. X, can you move your left leg towards the 3, towards the 3? So can you drag your heel until your number 3? So first we have to ask them to drag the toes and bring back, then drag that heel, bring back. Or is alternative is raise the leg and keep it another 3. Or is alternate. First one is number 1 and lift the number 2 or number 3. So then if the patient get the progressions, ask them to number 1, ask them to lift the leg from the number 1. So then number 3. So we missed the 2. So that means he getting the progression. He able to lift the leg from the 1 to 3. So this is going to be like a progressions. So that is we are going to perform in the sitting activities. So and also these activities are going to be improve the muscle strength and also coordinations. And also sitting unsupported foot and also touching the therapist fingers, which is the place in the air. So if the patient is in the sitting positions, so if the patient hold any put the fingers in the air, so ask him to touch the patient fingers. So in the sitting positions. So and also we have to ask them to do the sitting and standing and also sitting down. So ask them to give the task. Okay, within the 2 seconds, can you stand up and sit down? Or maybe from the long sitting to the toilet training. So if the patient is long sitting, so how much time it takes from the long sitting to the toileting training. So we have to check how he's going to be respond, how he's going to be do the activity in the sitting positions. And also I have to do the hitching and also hiking movement in the sitting. So ask them to move forward and backwards. So hiking and also hitching of the pelvis. So these are going to be increasing the awareness on the kinesthetic sensations and also helpfully increasing the coordination activities. Sittings and also walking on the buttocks. So ask them to sit and also walking on the buttocks is a move forward and backwards on the buttocks in the sitting. So if the buttocks have to move, the pelvis have to move forward and backwards. So ask them to move backwards. So it's going to the mat backwards. So this type of activities are going to be increasing the strength and also coordinations. Sitting beginning stage, stage with the upper limit support and also later without the upper limb support. So if you ask them to, so with support, so move forward, and without support also move forward, then is a backwards. So move is a backwards. So without support, first we have to train with the support. With support, ask them to push forward. And then we have without support, so ask them to move backwards. So these activities are going to be increasing the strength and also increasing the coordinations. So for the upper limbs, so also in the sitting positions, so alternative, we can ask them to do the supination and pronations, and also we can ask them to is a flexion and extension, closing and also opening of the fist. So opening and also closing the fist, supination, pronations, and also fingertips and also touching the fingertips and thumb. So these things are going to be increasing the activities and improving the coordinations and concentrations. And sitting in the reaching the therapist fingers, so how we done the assessment. So all the assessment, ask them to, the therapist hand is here, ask them to touch the therapist hand and touch the nose and therapist fingers. So if you change the movement, ask him to change from here, from this position to this position. So the patient also going to be change the directions. So it will help to improve the, and in the strength, and also is going to be improve the coordinations. And also sitting in the pegboard exercise. So in the, we have to give the pegboards. So ask them to pick up the, and also place the like in the holes. We have to ask them to these cubes has to fall, and also the blocks has to put into the pegboards. So it depends upon the size. So who are having the normal coordinations, so they can able to small one also. But who are having impairment, so they're unable to perform. First we can start with the larger size block, then we can go to the smaller size. So these type of activities is going to be increasing the coordinations. So, and also we can ask them to the sitting and also constructing some objects with the help of the block. So we can ask them to do the with the block, ask them to prepare one type of the shape, or ask them to put one on over one, and also, or maybe we can make them into the any building blocks. We can give them some building block and make them into one any shape or size. So these types are going to be increasing the concentration, as well as it is going to be increasing the coordinations. And sitting, transferring ball from one hand to other hand. So if you give one band, if they change, so this is going to be how much time it's going to take. Is it slow or fast? So these are where is a simple exercises, simple techniques to enhance the coordinations. And pushing and also is a punching movements. So ask them to do the, if the therapist hand is here, ask them to punch and ask them to push. So how is going to respond? Is it going to be very slow initiation movement, or is the patient is going to respond fastly? Or is the patient able to reach exactly the patient, the therapist hands? So how is responding? Or is going to be hypermetria or hypometria or dysmetria? So how is going to be reached the therapist hand or maybe fingers? Elbow flexion and also touching the shoulders with the palm. So ask them to touch the other hand, other shoulder here and there, therapist shoulders. So these are going to different directions. So these are going to be increasing the functional activities. And also we can ask them to combing, drawing, typing, and also shoelacing and normal household activities. So we can give some tasks, ask them to do the combing, ask them to buttoning and unbuttoning, and also ask them to draw pictures or circle, rectangular, and also trying to keep the a shoelace, and also is make them into shoelace tying and also tie off. So these activities are going to be the special tasks. So these are going to be improving the coordinations. And also in the standing activities. So the standing activities also ask them to stand in the proper positions. So and also ask them to walk on this like a stand in the Frenkels mat. So if the foot marks, so ask them to step, for example, the standing here. So ask them to move right side or left side or move forward. Which step? So ask them to move either the middle or the center, or this is the, for example, if the medial, the mid center, and also lateral. So ask them to right or the middle or the left. So for example, if you ask them to, if the person is standing is here, so ask them to, with a therapist command, okay, can you place right leg in the center of the print or marker? So they have to print here. They have to place the right leg on the center. Then we can, if we give the command, so ask them to keep the left leg into the left foot. Or you can ask them. So depends upon the command, the patient is going to be able to place the is a limb, right or lower limb or left lower limb. So this type of are going to be is improving the like a concentration and also is going to increase in the coordinations. Walking on the both sides footprints by leaving the middle footprints with a swing to and also swing a gait and the right foot forward or left foot. So we have to give according to. So ask them sometime we can ask them to try walk towards the right side and walk towards left side. So or maybe leave or place the in the middle. So if we give, depends upon the command the patient has to respond. And also sometimes we can ask them to do the side steps also, side walking. So these side walking also is going to be enhance the like increasing the strength in the abductor and also adductor muscles. So if they move towards the right side, so it's a side walking towards the right side. So it's going to be the in the right leg is going to the abductor muscles are going to be strengthening. In the left leg is going to the adductors are going to get strengthening. So ask them to reverse back. So again, the left leg is going to get the abductor strength and right leg is going to get the adductor strength. So this type of activities are improving the strength in the muscles and also helpful to improving the coordinations. And also pivoting activities. So these pivoting activities, if the patient is does like a sitting positions, so in the sitting from the sitting positions, so next one is we have to do the standing positions. So after the standing positions, so turning can be is practiced with the pivoting and also lifting, placing the foot marks. So these things, so ask them to do the pivotings. So these pivotings are after the standing activities. So we can do this standing. So we can ask them to pivot movements. Pivot movements means, for example, if the person is here at the right and left legs here, so ask them to stand in one place. So pivot to one side. So move the right leg. Okay, from here, right leg to here, it comes from again here. So it's going to be pivot. He slowly turn towards the right side, then two turns towards the left side. So these things are going to be the pivot. So what will happen? So he's going to get the like that means he's going to shift the weight shifting. So because of the weight shifting, is going to maintain the balance. So if they maintain the balance, so automatically is going to get the prevent the like falls and also prevent the abnormal postures. So these are going to be helpful to improve the coordination and also balance in the trunk as well as the lower limbs. So the weak side will be the stable in one point and also rotating with the fixed axis, and also another leg is lift and kept on the marked places. So if if they stand here, so ask them to turn towards the right side. So they are going to keep the right leg is going to change. So then slowly turn. So after that, we can ask them to reverse, ask them to turn towards the left side. So they have to do the right foot is rotated or turn 90 degrees and the left foot is raised and placed parallel to the right foot. So if they turn one side, so ask them to lift the leg and also ask them to keep it in the one place. So ask them to stand and also if they are concentrate first, eyes open, so slowly pivoting, turn towards the right side, then bring back to the left side. So until the 90 degrees. So this is the pivoting activities. So same thing, we are going to do the lifting activities for these progressions. So this progression, if the patient is now is only the pivoting. In the lifting one, the patient is standing. So ask them to lift the right leg and turn and keep it to the opposite side. That in the turning to the 45 degrees. Then lift the left leg and keep it one place. So then 45 degrees to again lift the right leg and turn back side. So and bring back here. So these things, afterward, this is going to be the pivoting. Next, we have to ask them to lifting. So same direction, we have to bring back to the left side. So lift the left leg and bring it to the 45 degrees and slowly lift the right leg and 45 degrees. So these type of the trainings are the important while giving the Frenkels exercise. So these are the supine lying activities and also half lying and sitting, standing, and also framing it. So these exercises are going to be increasing the coordinations. Other than these exercises, so many other exercise, special techniques are the rhythmic stabilization, slow reversal techniques are going, the PNF techniques are also helpful to improve the coordinations. And also if anybody get the tremors, so we have to use some weighting, and these are the especially the postural stability exercises. The postural stability exercises are especially the prone on hands and quadruped pose, kneeling exercise, half kneeling, plantigrade positions. So if we maintain these exercises, so because of the weight bearing on the proximal joints here in the hip and also shoulders and also back, So these muscles are going to be is activated, and also it helpful to strengthen the proximal joint. So it improves the, if we improve the strength in the proximal muscles, so we are going to get the stability in the joints. So we can prevent the is a like a incoordination. We can prevent the like a imbalance. That means we can prevent the falls. So these things are going to be for the like a quadruped positions, the prone on elbows and prone on hands, the progressions. Then we can bring back the kneeling positions, half kneeling positions, and also next we can bring from the half kneeling to the plantigrade positions and also modified plantigrade. So in these positions, we can ask them to do the on elbows, have to stand on the couch. So we have to keep on task, or is if we keep any like a ruler on the back, so they have to maintain the ruler, so without falling the ruler, so they have to maintain the balance. So if like this type of the task oriented trainings, so will improve the like stability and also improve the coordinations. So these are the Frenkels exercise. So and also next one is so many other techniques are there. So I think this is the, okay, I can stop here. The remaining I can continue in the next class. So now is almost is 1 hour. So I hope you understand until now. So the remaining exercises, the remaining training skills, so we will discuss in the next class. Thank you very much. See, see you in the next class.